Hi, everyone. This is Kate Berry, CEO of the National eHealth Collaborative. And on behalf of our Board of Directors, I'd like to welcome everyone to this program. We're very, very excited to have nearly all of our 12 HIE leaders that are profiled in a soon-to-be-released report with us today, some of whom are here today in the room, and others who are on the phone with us. And welcome to everyone who is watching the live webcast. So I would just like to thank also Jason Kunzman from ONC for joining us. We're delighted to have him. He's a member of the Beacon team. Well, shortly we'll be doing introductions of all of our HIE leaders that are participating. But I just want to do just some very, very brief opening remarks. First of all, I think we can all pretty much agree that HIE sustainability is an ongoing challenge for everyone. This is a large reason, one of the big reasons why NEHC commissioned a study of some of the very most successful health information exchange organizations in the country so that we can learn from those that are leading the way. This roundtable event is really a preview of a report that's going to be released very soon, which is entitled HIE Success Stories Revealed, Lessons from the Leaders. So this is going to be a preview conversation, and hopefully we'll be able to touch on sustainability models, touch on how these organizations can offer some guidance and insight for emerging health information exchanges, and begin to create a roadmap for national health information exchange. So we're very, very delighted to have everyone with us today. The plan today is to really just start a conversation. We're going to have a pretty informal discussion and hopefully get some of these interesting issues on the table and discussed among our leaders, touching on, key dimensions for success, as well as some of the key challenges and how they're being overcome. So with that, I would like to really kick off the discussion. And first, what I'd like to ask all of our guests to do, our HIE leaders to do, is to spend, let's say, and we have a lot of people in a fixed amount of time. We have about 90 minutes. But I'd like to ask each of you to do a brief personal introduction, and then give us, 3 to 4 minutes on introducing your organization, your scope of services.
The caller has joined the conference.
Your role in the community, and briefly what your sustainability model is. So with that, I'm going to start with the folks in the room, and I would like to ask Tom Fritz from Inland Northwest Health to just start with an introduction and an overview of your organization.
Thank you, Kate. My name is Tom Fritz. I'm the Chief Executive for Inland Northwest Health Services. We're a not-for-profit 501c3 kind of hospital-based company in Spokane, Washington. We've been in existence since 1994. And we came into existence as a result of our competitive hospitals actually trying to do some things in a collaborative way, where we ended up taking over a number of lines of services that were kind of difficult to manage and difficult to sustain in a competitive mode. So our job was to be kind of a neutral party and be able to keep those services available for our community and our region as a whole. One of the things that we did develop about 13 years ago was actually kind of a shared services model for information technology, which has kind of led to the development of our health information exchange. And we were somewhat criticized at first when we did that, and that we, at the time, a lot of the providers really used IT as a competitive product. We selected to do some things collectively and ultimately then significantly reduced our costs. So as an example, in our community we had 5 acute care hospitals. We reduced our data centers from 5 to 4. So we immediately started saving millions of dollars worth of infrastructure costs, and we also agreed to standardize a number of our hospital information systems, and really did that in a way that, again, saved us money and really started to create some value for us. We partnered with our physicians in the community. That was probably one of the most important things that we did in terms of really helping determine the value of our system. In fact, when we first started it, I did an analysis for all of our hospitals that showed that we were spending millions of dollars, but no doctors were ever looking at the system. There was multiple sign-ins. There were all these things that made it very difficult for them. And so we all thought we were doing great work, but it really had no value whatsoever. So over time, what we've been able to do is, because of this model, we have about 40 hospitals now in our region that outsource their information technology to us, and we do that as a shared service model. It's created a great opportunity for us in terms of sustainability, in that we have consistent revenue coming in, and everybody takes a share of what they use of the system. And so our expectations really of managing the hospitals is that we continue to do things that create value-added service. And so for us, the sustainability issue is one that we have to do more with less. And especially with the economics the way they are today, we have to continue to do things that help our physicians and our hospitals be more efficient and be able to get greater value out of the system that we've created. And that's kind of the direction that we're taking. I think we'll see us adding on more kinds of services onto our health information exchange, such as data analytics, other kinds of things, report cards, and clearly we stay away from things like transaction fees and even membership fees. We really do it in a different type of business model. So I think that's my 4 to 5 minutes.
Thank you, Tom. And Russ, would you like to go next, please?
Great. Thanks, Kate. Thank you for having us here. I'm Russ Thomas. I'm the President and Chief Operating Officer of Availity. Been with Availity since 2008. Prior to that, I was the Chief Executive Officer of a company called Gold Standard, which is a clinical knowledge-based business focused particularly in pharmacy information, pharmacy knowledge bases. We sold that business to Reed Elsevier in 2006, and I joined Availity in 2008. Availity is interesting listening to Tom. Availity is a little different model. First and foremost, we're a health information network. So what we really do is bring stakeholders together within our network. So today we have over 200,000 active physician users of our system across the country. We have over 1,000 health plans that use our platform and thousands of U.S. hospitals as well. So in 2011, we'll transact over 1 billion transactions across our network. We've historically been focused in administrative transactions, so the kind of electronic events, electronic activity that physicians and health plans have to interact with each other all day, every day. So everything from basic eligibility and benefit transactions to claim transactions, and then moving upstream in the value chain to things like member estimation, so that in real time a physician can determine just how much a patient owes at the point of service. And now ultimately moving into clinical transactions. And one of our core principles is that we take a very holistic approach to health information. We believe that it's important, and one of the reasons for our success has been that we combine transaction types and information types across one network. So at the same time we tell a physician office whether a patient is eligible for benefits, we also share access to clinical information, what we call our Availity Care Profile, which is essentially our electronic health record. We found that by driving information across that common framework into the workflow, one of our mantras is serve the physician where and how they work. We found that by driving that information across a common framework into their workflow, we get adoption and utilization of a lot of different types of capabilities. Our business model has historically been transaction fee driven. We charge specifically health plans for the transactions that we serve up across our network. So every time we run an eligibility and benefit transaction or a claim transaction or even our clinical transactions, we are charging a transaction fee to the health plans. Historically, the business has been funded exclusively by health plan revenues. Last year, we acquired a business some of you may be familiar with called RealMed. It's a revenue cycle management business focused primarily in the ambulatory space. And that business is actually both a health plan sponsored as well as a physician subscription fee driven business, and frankly is about 50-50 in terms of the revenue mix, physician monthly subscriptions and health plan revenue. So we found, I think, a fairly interesting revenue model, sustainability model that lets us drive value across really all sectors of the value chain, from health plan to physician to our vendor partners. We have over 400 vendor partners that use our network to transact between physicians and health plans. And those are historically practice management systems that connect to us. But now we've started implementing with electronic medical records vendors as well, so that, again, at the same time that we're delivering up that administrative information that physicians need to run their business, we're also leveraging that platform to deliver clinical information as well. Just a little bit on background. We're a for-profit business. We are a joint venture of 5 large health plans. Our joint venture partners are Blue Cross Blue Shield of Florida, Humana, WellPoint, HCSC, Healthcare Service Corp., which is Blue Cross of Texas, Oklahoma, Illinois, and New Mexico, and Blue Cross Blue Shield of Minnesota. And with me today, I have to introduce Kathleen Herzog, who is our VP of Marketing and Communications, and her primary responsibility is keeping me straight. So I keep looking at her saying, am I saying what I'm supposed to say, Kathleen? And she's giving me the head nod here. So that's a little bit about us. I'll be glad to talk more about it as we go through it. And again, thank you for having us with you today. It's a pleasure to be here.
Thank you, Russ. Dr. Blair?
Yeah, thanks, Kate, for inviting me, and I'm happy to be here. I'm from the Hudson Valley. I've been a practicing physician for 15 years in academic private practice. Left that 5 years ago because this project's finally completely consumed all of my time. But I'll talk about not just the organizations that I'm part of, but the Hudson Valley Initiative in general, because it really has been driven and has succeeded because of 3 organizations. I'm with Taconic IPA, a 5,000 physician independent practice association in the Hudson Valley. I also run MedAllies, a health information service provider that is located in the Hudson Valley, there to help implement and support health information technology. And then there's another organization run by Susan Stewart, which is Think, which originally started as a RIO, but really has evolved to a regional organization that really has, I think, expertise in being able to extract from the various stakeholders, healthcare stakeholders, and within stakeholder groups, leadership to convene and really move the community with a kind of governance structure that gets small wins, credibility, and achieves something that's hard to do in an open community. There's no IDN in the Hudson Valley. Hundreds of practices, from solo practitioners to 200, 250 doctor groups, federally qualified health centers, 20 or so hospitals, 6 or 7 health plans that make up the bulk of the commercial care. So it's, I think, typical of a lot of communities without an IDN, and Think has been able to get some of the principles of governance across an open community. I think that's a lot of the success. The IPA, about 10 years ago, started to focus just on quality initiatives, and over the last several years has really been focused on patient-centered medical home, practice transformation. The MedAllies was really started to help providers implement and truly utilize for better clinical care